Hyperlipidemia and obesity are two closely related health conditions that have a significant impact on an individual's overall well-being. Both conditions are major risk factors for various cardiovascular diseases and can have a profound influence on a person's quality of life. Let's explore each of these conditions and their interplay in more detail. Hyperlipidemia. Hyperlipidemia refers to elevated levels of lipids, fats, in the bloodstream, particularly high levels of cholesterol and triglycerides. These lipids are essential for the body's normal functioning, but when their levels become excessively high, they can lead to serious health problems. There are two main types of cholesterol. 1. Low-density lipoprotein, LDL. Often referred to as bad cholesterol, high levels of LDL cholesterol are associated with an increased risk of atherosclerosis, where plaque builds up in the arteries, narrowing them and impeding blood flow. 2. High-density lipoprotein, HDL. Known as good cholesterol, HDL helps remove excess cholesterol from the bloodstream, reducing the risk of plaque buildup. Hyperlipidemia is typically caused by a combination of genetic factors and lifestyle choices, such as a high-fat diet, a lack of physical activity, smoking, and excessive alcohol consumption. If left untreated, it can lead to various cardiovascular issues, including heart disease, stroke, and peripheral artery disease. Obesity. Obesity is a chronic condition characterized by an excessive accumulation of body fat. It is usually determined by one's body mass index, BMI, which takes into account weight in relation to height. An individual with a BMI of 30 or higher is considered obese. Obesity results from a prolonged imbalance between the number of calories consumed and the number of calories expended through physical activity and metabolism. Obesity is associated with several serious health consequences, such as 1. Cardiovascular disease. Obese individuals are at a significantly higher risk of developing conditions like hypertension, atherosclerosis, and heart disease. 2. Type 2, diabetes. Obesity is a primary risk factor for type 2 diabetes, as excess body fat can impair the body's ability to regulate blood sugar. 3. Respiratory issues. Obesity is linked to breathing difficulties, including sleep apnea and obesity hypoventilation syndrome. 4. Joint problems. Excess weight puts added stress on joints, increasing the risk of osteoarthritis. Hyperlipidemia and obesity often go hand in hand and can exacerbate each other's effects. Here's how they are interrelated. 1. Increased lipid levels. Obesity can lead to higher levels of triglycerides and LDL cholesterol in the bloodstream. 2. Insulin resistance. Obesity is a key contributor to insulin resistance, which can affect lipid metabolism and lead to hyperlipidemia. 3. Chronic inflammation. Both conditions can trigger inflammation, which further contributes to cardiovascular risk. 4. Shared lifestyle factors. Unhealthy eating habits, sedentary lifestyles, and high-calorie diets are common risk factors for both obesity and hyperlipidemia. Addressing both hyperlipidemia and obesity often involves similar lifestyle modifications, including dietary changes, increased physical activity, and, in some cases, medication. It's crucial to approach these conditions holistically under the guidance of healthcare professionals, as they have a substantial impact on a person's health and longevity. Preventive measures such as regular exercise, a balanced diet, and maintaining a healthy weight can significantly reduce the risk of developing these conditions